everyone. My name is Emily Zakak. I work as a cybersecurity associate here at Sennovate, and today I have here with me Vikrant Arora, former CISO for Hospital for Special Surgery. So thank you so much, Vic, for joining us to have a conversation today.
Happy to be here, Emily.
Awesome. So we are going to be getting into these questions, many cybersecurity questions that many people might have. So, as we know, there are a lot of emerging cybersecurity threats in the cybersecurity threat landscape. So, what do you consider the most pressing cybersecurity threat facing the healthcare organizations today?
Yeah, I think healthcare in general is a very lucrative target. I mean, cost of patient records far exceeds cost of other types of sensitive information. Plus, any disruption to a hospital can impact patient lives. So hospital organizations are more likely to pay ransom as compared to other industries. And that has led to, in my opinion, the four biggest threats that I would consider that the healthcare industry is facing is primarily due to poor cyber hygiene, where IT and security controls haven't kept up with the emerging threats due to lack of talent, budget, or a process-driven approach. The second is a large attack surface. Hospitals have a lot of biomedical devices that have legacy software, hardware, plus they're taking on this digital innovation journey. So they're adopting cloud and technologies such as AI. So it's a very continuously increasing attack surface. And the third is third-party risk. I mean, there's a complex ecosystems of vendors, third parties, fourth parties. And even though you secure the organization you're working for, you are inheriting the risk from all these other parties in the ecosystem. And finally, human factor continues to play a big role, where people continue to click on phishing emails or make errors or fall victims to social engineering attacks. So these are the four threats that I think are currently being making the news.
Thank you so much, Vic. Absolutely, the cybersecurity threat landscape is continuing to grow as we become even more modern and we go into the future. So, in addition to that, we have biomedical devices such as pacemakers and insulin pumps, and they're becoming more connected to the internet and connected overall. So, how do you ensure the security and protect patients from potential cybersecurity threats within those technologies?
Yeah, like I said, they contribute to the attack surface quite a lot, and they're the least protected crown jewels in a healthcare environment, because on a traditional PC or a server, you could put a lot of security controls. On these devices, you cannot put controls, and on top of it, they have legacy software and hardware, third-party software such as Log4j and other things that are extremely vulnerable. I think in order to have a secure biomedical device footprint, it needs to be a multi-pronged approach where the device manufacturers, the government, healthcare security practitioners, and consumers, they all need to pitch in. As a CISO, what I've done is that before a device gets deployed in the environment, there are some foundational controls, such as having a business associate agreement with the vendor, making sure they disclose all the softwares and hardwares that are included in the device. Now they're called the software bill of materials. Make sure that they are contractually obligated to meeting certain security guidelines that before a device is bought. Once it's installed, we perform a risk assessment to make sure that we determine any threats that are specific to the use case at hand. Like the threat modeling for a pacemaker is very different from a bedside monitor. And then we implement controls such as microsegmentation or limiting internet connectivity based on the use case of the device. And then during the operational phase, we make sure that we have investments in technologies that allow us to maintain an accurate inventory of medical devices, monitor what the normal behavior is. So in case there's a compromise, we can detect that deviation, and also monitor for any vulnerabilities that come up after the device is deployed. So that's from a healthcare practitioner standpoint. The government recently released a refusal to accept a guideline that puts more burden on the manufacturers to incorporate more security. And as a consumer, I would encourage all of you to, if you're using a medical device, make sure you either talk to your private physician, general physician, or somebody who has technical knowledge in the household to make sure you're keeping up to date with passwords and updates of those devices. So it needs to be a joint approach to handle this risk.
Thank you so much, Vic. And next, we will also be talking about, for example, COVID-19. A couple of years ago, there was a surge in COVID-19, and that led to a surge in telehealth as well. So, how do you address patient privacy concerns when conducting remote medical consultations?
Yeah, that's a great question. We saw an extensive exponential increase in use of these digital collaboration tools such as Zoom and Teams during the pandemic, and some of it has continued. And you're absolutely right. There are not just security concerns, there are privacy concerns as well. So I think in general, from a process standpoint, I always start with taking a risk-based approach, doing a threat modeling, understanding how the technology is going to get used in a patient care environment. And in the case of collaboration tools such as Zoom, Teams, or Google Meet, we want to make sure that there is end-to-end encryption. So any data that is flowing through these platforms is secure and unauthorized parties cannot view that information. The second is these modern technologies leverage APIs, application programming interfaces, to make sure that not just the users are authenticated, but the APIs are authenticated as well. And last but not the least is to make sure that there is sufficient education and configuration, such as enabling passwords for Zoom meetings or having a unique meeting ID rather than a generic meeting ID. And in some cases, for more sensitive use cases, we also enabled features such as like a waiting room or chime on entry to prevent Zoom bombing and other things that were being talked about in the press at the time.
Thank you so much, Vic. So, in addition to that, we all know that cybersecurity can be a difficult topic of conversation to talk about. So, how do you communicate cyber risk to management and the board?
It's another great question, and it's something that I enjoy very much, not just measuring and managing risk, but communicating risk to various internal and external stakeholders in a manner that they can not only understand it, but use it to make business decisions. And to answer your question, I usually break it down into three separate buckets. The first is communicating business cyber risk, and that can be operational or strategic in nature. Strategic risk is items that can go wrong in the long term if they're not managed well. And operational risks are items that have already gone wrong due to failure of people, processes, or technology. But it needs to be in business terms, such as damage to reputation, loss of patient data, risk to patient safety, loss of revenue, or disruption to providing care. It has to be in those terms and not technical terms for the board and senior management to understand. The second bucket is business enablement. I think cyber is at a point where it can not only protect the business, it can truly enable the business by removing friction and improving productivity. So highlighting that piece. And last is to demonstrate overall security program maturity against industry best practices such as the NIST cybersecurity framework or the CIS standards, so that board members and senior management can compare your organization's security with the peers and they get a sense of where you are in the overall scheme of things. So those are the three buckets that I use to communicate various KPIs and KRIs to the board and senior management.
Absolutely. That's amazing, Vic. Definitely pointing out those issues that are going on with cybersecurity and really bettering your organization can
Yeah.
definitely help lead to providing that comfort
Yeah.
for everyone.
One thing I will say is that before you do that, I think CISOs and other security executives, they absolutely need to do two things, understand two basic things. One is what the board's technical cyber acumen is, and raise it to a level where they can process this information. And the second is what their duties are, what are their responsibilities from a cybersecurity standpoint, so you can meet them where it's beneficial to them, and you meet their expectations from a CISO. And this exercise also helps you build a relationship, which makes digesting the information that I was talking about earlier a lot easier.
Thank you so much, Vic. That is amazing advice for any CISO. So, in addition to what you said before about how there is a lack of cybersecurity talent, what career advice would you offer to individuals who are at the early stage of their cybersecurity career?
Yeah, that's interesting because what I've seen in my 20 years working as a cybersecurity and risk management professional is that there is no linear path to cybersecurity. I've seen people with formal education that enter the cyber domain, technical folks from IT department, network engineering making their way, and I've even seen people from compliance, internal audits, or some from the business as well enter into the cybersecurity domain. So I think it's encouraging as long as you have problem solving, analytical skills, and a passion for the domain, there is a way to enter it. And at the same time, I also advise everybody not to think of CISO as the ultimate role because it is not meant for everyone. Honestly, I've seen excellent security engineers, incident responders, forensics experts, and architects who choose not to be CISOs but are world renowned for their contributions. And finally, those who are looking to be a CISO, I would break it down into three competencies when I'm mentoring younger professionals. That's what I advise them on. First is make sure you have domain knowledge, whether it's operations, governance, architecture, you understand some or as many domains as possible. The second is make sure you have business knowledge. At the end of the day, you need to either protect or enable the business or the organization you're working for. So make sure you understand how the organization works. And last is to have leadership and management skills, managing budgets, talents, communicating clearly, building a culture, collaboration, and agility. So those are the three areas where I encourage people who are aspiring to be CISOs to focus on. And there's some tactical steps you can take, such as joining a nonprofit board or a local board, finding a mentor. I've been blessed to have many mentors who have helped me throughout my career. And once you become a CISO, I would encourage you to suppress your instincts to build mousetraps and focus more on business enablement and reducing business risk.
That's amazing. Thank you so much, Vic. Definitely, all of these different pieces and different roles in cybersecurity come together to really protect an organization. So I think that is one of the most amazing parts about the cybersecurity landscape and the cybersecurity career, that we're all working towards making the world a safer place. So, in addition to that, what are some strategies you would suggest for CISOs to protect against phishing attacks targeting the healthcare staff?
Yeah, it's unfortunate that after decades of investments, phishing continues to be the primary vector for most attacks, including ransomware. It does require a multi-pronged approach, and the biggest one that I always lean forward with is education. So make sure that all your users they are educated to not only identify a phishing attack, but also empowered to report it. I mean, it should not be looked down upon. It should be encouraged so that you reduce the number of clickers in the organization while increasing the number of reporters because you need both to prevent yourselves and safeguard yourself. Besides the education aspect, I think we need to have a defense in depth where there are security technologies at the perimeter, such as email proxies that prevent most known malware or phishing emails, as well as endpoint security technologies in case something comes through and is executed on the endpoint. It can be we can protect against that. And then the last thing I say is make sure that there is enough automation because things will always fall through the cracks. So if we can respond quickly and if an email is delivered and not caught by our defenses in time, we can quickly remove it from the environment before it can cause further damage. All this can help reduce the chances of a phishing attack. And I also suggest having a process-based approach so you can actually measure the effectiveness of each of these investments and not just keep layering technology on top of technology, hoping that it works. Make sure that it's all process driven and measurable for you to be effective in what you need to do.
Absolutely, Vic. Definitely, those processes must be implemented in order to really prevent those phishing attacks because humans, as we have found out, are the weakest link when it comes to those phishing attacks. Up to 91% of cybersecurity attacks are actually started by phishing attacks.
Yep.
So that is just a little interesting piece of information. So, what are also some emerging cybersecurity solutions in the healthcare industry that are being advanced with AI tools? And what are the pros and cons?
So I'll probably answer it a little bit at a higher level. So beyond cybersecurity, I think AI has a lot of promise, especially for healthcare. There's an opportunity to improve diagnosis and treatment through faster drug discovery. There are machine algorithms that can triage images and pathology reports. There's an opportunity to improve patient safety. AI and machine learning-based softwares can reduce errors and adverse events such as medical reactions, alerting professionals to safety risks and take proactive steps to prevent harm. We also have an opportunity to improve both the patient and care provider experience through real-time on-demand navigation through virtual assistants and chatbots. Virtual nursing assistants can help with acute shortage of nursing, especially in the rural sectors. And from a security standpoint, it can help us identify fraud or deviations or abnormal behaviors in the network a lot quickly, and also automate responses to do that. So I just wanted to provide that a little bit higher level answer. I think it has a lot of promise. But at the same time, computers can make errors at scale. Headcounts needed to implement AI, perform data modeling, check for errors can sometimes outweigh the efficiency gains. So it's important to start with a clearly defined business benefit, quantified from the get-go. And there are many risks at this point which may not outweigh the cons, such as, confidentiality. Any data that is entered into an AI or a chat GPT type of a platform is not protected with the same rigor as other applications that process sensitive data. At the same time, any output that you get from these platforms is at risk of being biased or inaccurate based on the data that was fed to train the model. And there are availability risks where these public AI and private AI solutions, they can change their service level agreements, they can add on new features, or they may be unavailable for a longer period of time. So you have to worry about availability. And the last one that I think makes these specifically AI very unique is the socio-technical nature. Traditional softwares are very static by design. You give a certain input and you expect and you get the same output. AI, on the other hand, is an evolving software where it can have impacts beyond the organization, and the system is evolving as it's used. So we need to be mindful of the societal impacts of AI as well.
Thank you so much, Vic. So you would say that beginning with an assessment of that organization's cybersecurity solutions and overall infrastructure would be the best approach when implementing AI.
Yes, it should totally be use case driven, and the risks need to be baked into any decision making.
Thank you so much, Vic. So for our final question, can you share any insights on your long-term vision for the healthcare cybersecurity, and how does it align with the evolving healthcare landscape?
I think it's evolving very rapidly. The threat landscape is changing with advancements in cyber criminals, nation state activity. At the same time, like I was saying, attack surface is evolving as we incorporate more digital solutions. And the regulatory landscape is also evolving as they try to catch up with privacy and security concerns. So we have these very volatile environments. And I see areas of opportunities for basically security practitioners, the CISOs, the management, and the board. Specifically speaking, and I touched upon it earlier, CISOs need to be more outcome-based. We are constantly deploying new tools, and we need to manage the outcomes rather than get in the business of managing technologies and making sure we have all the technologies under the sun. And the outcomes are basically risk reduction, business enablement, or regulatory compliance. So we need to make sure we have process-based approaches, and we can actually qualify or quantify risk reduction from every dollar spent on cybersecurity. This will also help with staffing and budget challenges. From a senior management standpoint, I think they can improve security culture in an organization where users, like I said, are empowered and educated, and all business decision makers, they take cyber into account when they are adopting new technologies. And finally, I think the board, and we've seen that from the recent SEC regulations as well, they can foster risk-based decision-making as well by exercising more risk oversight and be more educated on cyber and influencing that from the top down. So I think there's area of opportunity across all levels to handle this very evolving problem.
Thank you so much, Vic. So one more question that I actually have for you is that How do you feel about the healthcare industry adopting all these different technologies? So you have all these technologies doing their separate um, tasks and what they're meant to do. So how do you feel about that?
I think it's increasing the complexity in the environment, and one of the best ways to reduce risk is to reduce complexity. And what I personally try to do in various engagements is take a platform-based approach that has automation, so that you don't have multiple technologies that don't play well with each other, but you have best of breed across the board, and the overall effect is not as great. But at the same time, you have to be cautious with platform-based approach. You don't want to compromise on the security functionality. So it's a fine balance between reducing complexity by taking a platform-based approach versus using a best of breed. So it all needs to be based on like threat modeling. And I think if we keep our eyes on the North Star, which is how much risk we are reducing, how we are enabling the business, how much compliance we are assisting with, that can help adjust where you are on that spectrum.
Absolutely. Thank you so much, Vic. Definitely, all of these cybersecurity solutions always come back to that risk. So, always minimizing that risk. So, thank you so much, Vic, for joining us today for our podcast. It was amazing speaking with you.
Likewise, thank you for the opportunity, Emily.
Thank you.
Bye.